Welcome back to part 2 of our special series, How Sutter Health is Scaling AI Across the Enterprise. If you haven't heard part 1, go back. It's awesome. It sets the foundation. This episode today, we're going to go deeper. Kiran Mysore shares how to turn physician pushback into buy-in, how to balance innovation with empathy, and what it really takes to govern AI at scale without slowing things down. You're going to hear how Sutter built an AI council that spans legal, compliance, digital, clinical, and research, and why that made them faster, not slower. We also unpack the tension every health leader faces, going fast enough to stay relevant, but safely enough to earn trust. This is not theory. It's the inside playbook for executing bold, system-wide change. Grab whatever you take to take notes. This is a good one. Enjoy. But let's talk, and I'm imagining you referenced it, I forget the words you use, but your providers seem to be very hungry to use new technology to make their jobs better. And I would say almost revert back to the 60s when they could carry a bag and knock on doors and get back to like traditional, like medicine, right? A traditional job description for a doc. So, but I'm guessing, especially for our listeners, that there's different provider cultures at each organization, and there's probably a different proportion of the providers, the doctors in particular, who push back because they've already been overwhelmed and they're still not over the meaningful use kind of PTSD and all that. So thinking about some of the naysayers you probably have had to deal with, I'm sure maybe less than more, but provide some advice to our listeners about how you take some of the pushback and convert a no to a yes, if you will, through your whatever strategies you have in place at Sutter.
Eric, a really important aspect of any of this is rounding, to be able to go to hospitals and to talk to physicians and really understand sort of where they're at. And one of the things I do is to actually visit, hospitals and do some talks on AI and the potential of AI. And in a forum of maybe 30, 40 physicians, I ask the question, tell me what's holding you back. And I get a long, a range of things, ranging from the simple things that are, hard, like I can't log into my system or my system times me out. I mean, very simple things that can be fixed, and we fix them right away, to areas where they go deeper, like empathy, for example. So we built a tool that can actually look at all of the physicians' in-basket messages and summarize information for them so that they can have a starting point when they write a clinical note. Well, one of the things that AI doesn't do really well right off the bat is show the right level of empathy. But it can be trained, and over time, it actually can start to become more empathetic and use the right choice of words given the situation. And so physicians want the note to sound like them as much as possible. And I had one physician that told me, look, I started using this tool, and then my patient told me that the note doesn't sound like me. So what is that all about? And so the key is to make sure that wherever you start with, we provide that level of personalization as much as possible. And so the training of AI is important in that space to really cater to that. So that's one example of a pushback that over time, taking that feedback in and then ultimately reflecting it back in the tool is going to get you a lot of supporters along the way.
Yeah, I love that question. What is holding you back? So simple, but brilliant, right? And then you zip your lip and listen. So in the spirit of, we know clinician burnout is real, but so is tool fatigue, right? I just mentioned the PTSD issue with meaningful use. So I've heard you talk about how layering on more tech can backfire if it's not like thoughtfully integrated. I think, in your approach of like what's holding you back, it could be part of the answer. Is there anything else on how do you approach this balance between, tool fatigue, physician, and trying to help them out of physician burnout, which, ironically, tools can help with?
It's a balance, and clinicians and physicians, they're really excited about the potential of AI, right? They come to me all the time saying, "Hey, I saw this great thing. Let's go implement it." At the same time, you know, the reality is we understand as a AI organization all the aspects that go into making AI successful. It's good data, it's good workflow integration, it's good communication and planning. It's scaling from a pilot to large scale. It's about communication, co-creation. I mean, there's so many of these aspects that come into play. And so, what we do is to balance innovation, which is new ways of doing things, with the realism of implementing it in a complex healthcare ecosystem. We have to do that balance all the time, and our governance is a great way. We recently hired a chief AI officer. Really excited about this, Dr. Ashley BC, and one of the things she's actually working on is to really create this governance council. And it's a group of folks that are well established in the business, in the healthcare, in our ecosystem, who understand what it takes to bring something like an AI to life. And we use their advice and their knowledge and their advocacy to then help influence the right areas to focus on. So I think that's one way to sort of balance it, which is really to have a governing body that has got the right level of knowledge and understanding of AI in the clinical application in the workspace, and be able to use their help to really drive adoption as we go. So,
You don't need me here. I was going to go to governance. You already went there. I mean, you don't need me kind of asking you questions. You could do this solo right now. That's great. So let's talk about governance. The chief AI officer, you mentioned doctor, so a physician.
yes.
Okay. And they're going to are they leading the governance committee or whatever we're going to call that? Can we call it the governance committee for purposes of this? Is that the right term?
This conversation, yeah, we could call it the AI Council, and it is really a cross-functional group of experts, right? So we have obviously our digital team is in there. It's already in a leader in that. We have compliance, privacy, security. We have legal, regulatory organizations in there. We have a great clinical representation, quality representation. We also have our research arm as well in there. And so all of these have different points of view and use cases and potentially benefits when it comes to AI. So the opportunity we have is really to bring them together. Now, a lot of folks also say, when you put a governance of so many people in, isn't that going to slow you down? And our argument is actually that it speeds you up, because we have the best folks at the table who are thinking holistically about AI, who have the knowledge and the experience of the right questions to ask when new AI capabilities come into bear, and who have the ability to influence decisions and process and workflow, so that we can maximize the success of AI. So when you want better than to have a body like that can actually move things faster. And we've seen some great success. And one of the studies I read, which I quote all the time, is organizations that have mature AI governance tend to do AI about 2.3 times better. They execute better than organizations that don't. And so what we are proud of is that we focused on the governance aspect early, and we built it up over time, and we're excited to sort of take it to the next frontier to really enable AI at scale.
Okay, so you got the chief AI officer, you got a digital leader, someone in compliance, someone in security, someone in legal, someone in clinical, quality, research. You didn't mention innovation, but I'm sure research / innovation. All these different personalities, mindsets, purviews on the world. How are you? What rules do you have in place? So for this committee to make decisions, is there a voting methodology, just an overall governance within the council? You mentioned the players, but I'm getting just a mild headache just thinking about all these different personalities. I'm using my personal experience of working with great folks with these roles, but all having very different personality types.
Yeah.
How are you getting to decisions? Is it by majority, unanimous decisions? Like, is
It's
it?
it's Actually, Eric, it's easier than it sounds, and I'll tell you how this works. Right? It's not that we bring everybody in the same room and ask them to do everything. The nature of what this council works on can really range from intake, which is what do we work on? What are the most important things to work on? To implementation, which is how do we best roll this out, and who are the right teams to go leverage this and use it? To ROI, which we talked about, how do we measure this and what are the right ways to measure something? And then to monitoring and sort of after, drift, for example, or control in general. So these are all the different sort of parts of your process of really rolling something out at scale. And what we have done is really kept the decision making very lean to a handful of folks on the committee, where the most important decisions can be quickly provisioned. But then when you get into the specifics of how to do something and what is the right way to do something, we have subgroups or working subcommittees that are established. For example, we're implementing a new AI tool. What is the privacy policy on that, right? We can go to the privacy subcommittee and actually ask them to help draft it. And so they're not necessarily voting, they're actually helping co-create it and draft it. So we're actually moving faster because the committee or the council is actually helping us move forward. So that's sort of how we think about it. It's a partnership and a coalition of the experts that can actually help advance the policy more than someone that is sort of gating it and governing it and sort of saying yes or no. So hopefully that.
Two quick follow-ups, and we'll get off governance. Okay. So you mentioned a couple people are decision makers. You ultimately make the decision, or you're limiting to that. Can you kind of unpack that a little bit so we understand? Is it the CEO coming in? Is it the chief AI officer? Is it you? Like, just who's tasked with that? And then the second question is for everyone listening who's more like in their early stages. Like, what kind of people need to be in the room when standing up AI governance from day one? Is it exactly the group that I just outlined? Or are there other different kinds of people and then roles, and then what kinds of decisions do they need to prioritize? So,
yeah,
the decision maker, then how Sutter's making decisions, like who's involved, and then for people just starting right up on day one, are these the players, or should you shrink the group initially, and then how are you making these prioritization decisions?
Great questions. We started organically. We started small, and the early beginnings of the governance was really sponsored by our chief digital officer, Laura, and then our chief legal counsel, Kiran Mysore. So both of them, the legal side of things and the digital side of things, felt like the right starting point to make some quick decisions along the way. And of course, Warner, who is our CEO, is super involved in AI. He speaks about AI all the time in forums, and is a really great sounding board about what the right priorities are. So we've got that as a starting point. And when it comes to the nuances of AI and the specificity, we've got our chief AI officer who helps guide decisions and frameworks around which way to go. So you've got this sort of starting point. But then if you're talking about clinical AI, for example, we've got some great physician leaders who actually jump in and help shape the way we want to design this and move things forward. So if it's clinical AI, it's a group of physician involvement. If it is efficiency and maybe productivity, we've got our CFO who's deeply engaged, and some of our operations leaders who are very deeply engaged as well. If it's customer focused or patient focused, we have a handful of decision makers that go from a customer experience standpoint who drive that as well. So it really depends on what you're solving with AI. It's not a one size fits all. It really depends on the use case and the specificity of it. But we do have a small core group that can help orchestrate and quarterback everything and drive things forward.
Okay, so if I could summarize that was really good. You sort of categorize the AI initiative and determine who's going to make your decision. So if it's a clinical, then it's probably your chief medical officer makes the final call. And maybe it's not exactly that title, but just to give people efficiency in production, you have a CFO, CEO, or someone right up there in the senior team who runs those. Customer focused, you have someone in charge of customer experience. And ultimately it bubbles up to those C-level folks who make the final call.
Yeah, they help orchestrate it. And sometimes there are trade-offs to be made, and so we have a discussion about it. And that's why the council is important. So we can engage with them. But the way you outlined it, Eric, makes that's exactly how we do it.
Okay, great. So I want to shift gears a bit. Is that okay? We're gonna shift,
Absolutely.
and I want to tap into your experience, and from tech to med tech, healthcare, and all the cross industry experiences that you've had, that seems to have shaped your own data strategy. How has just the approach at Sutter evolved based upon what you've seen work in the other industries that you've been in?
Eric, this is great question. Firstly, I'm very grateful and fortunate to have had many diverse experiences. I've been in the financial services, in retail, in high tech, and many other industries, and I've seen sort of what works in each industry. Healthcare specifically is a very regulated industry, as all your listeners know, and so things tend to take time because we want to make sure we are addressing risk and trust and all the factors we talked about. So other industries have similar approaches as well. Financial services, for example, is also very regulated. But one of the things I've learned from some of these is what is the right balance to strike between going fast, being innovative, and then being responsible and governed. And that right balance um, is not easy. If you're in healthcare and healthcare is all you might over-index on maybe the risk side of things and make sure you go slow for this to make sure all the boxes are checked. If you're on the startup side of things or the high-tech side of things, you might go really fast because you want to break things and you want to innovate very rapidly. And so the balance we need to strike is somewhere in between. And what I bring with all my experiences is really that right balance. In the way we designed our data, I always talk about two speeds. I talk about speed of the business, which is really our clinicians, our physicians, our operators who want to go fast and build solutions and meet the needs that they have. But speed two is the speed of foundation building, which is the data and the right controls and the right governance and all of the aspects that go into quality and such. And they're not the same speed. Speed one obviously is going very fast. Speed two takes a very long time. The trick is to blend the two together. And this is something I've talked about in many cases is you have to sort of think about what addresses the most immediate need and build it in a way that also advances your technology and the technology foundation. And so my exposure to having done this in other industries helps me think about this in a very different way and puts me in a position where I can actually advocate for many alternates to how you can build something. And that helps us go fast, ultimately, with the right guardrails and the right controls.
Yeah, love this. And I think this is super, super hard to do. So I want to make sure we get a little bit prescriptive here. So I have a follow-up. So you mentioned speed of the business, and you balance that with the speed of the foundation that you're building. First one's fast, second one's a little slower. And recognizing that, healthcare, I think a lot of folks in healthcare are self-aware enough to know other industries, the similarities and differences of other industries, but still haven't really been able to effectively take the ingredients of those other industries, those bright spots in other industries, bring them into healthcare and effectively drive a better balance. Because what I heard you saying, please tell me if I'm putting words in your mouth, is because we're so heavily regulated and because patient safety is so paramount, we inherently have a culture of slowness that's probably a little too slow. But we can't be like the innovation or tech world where we're going super fast and breaking things because we don't want to break people. So how would you recommend taking this balance of speed of the business and speed of the foundation building and actually drive meaningful change at other organizations who are listening right now? And I know that's a hard question, but what would you do if I plopped you down at a health plan or health system that's just maybe not as progressive as Sutter, for lack of a better way of saying it? What would you do to try to take those two components and change the culture at a new organization?
Eric, I think about healthcare as a team sport. It is, when we all work together, we win together. And I think the complexity of healthcare can really be solved if we really collaborate, look at best practices from each other, and start to incorporate them with a common goal. And this is what I think Sutter has done an amazing job at, which is a concept we call One Sutter, where we bring together leaders from across the organization in a common unifying purpose of serving our patients. What I would do, right, is essentially to sort of build upon that, eh, and create strategies and technologies and capabilities that really draw everyone together. And the importance of team cannot be overemphasized here. The you are what your team is ultimately. So we definitely want to recruit different points of view, different diverse points of view to really build that capability, and drive that forward. So I think teamwork, team sport is probably the first starting point for me. The other thing is, we have a million things we can go work on. What's the most important thing, right? We have to start with use cases or opportunities where we know that AI can actually solve, and assuming it's an AI solve that we're trying to go after. Now, it's very easy to sort of say, well, this is a problem. Let's or here's a tool. Let's go figure out where it will work. I mean, that's completely the opposite way of thinking about this. So find the problem areas and really see if AI can help, and then start to put a whole program together to go attack that. But don't sort of live in the pilot land. Go big, go deep, and put the right governance structures in place so you can actually be successful. You don't, unintentionally cause outcomes that our patients don't want. You actually promote our physician well-being in the process of providing care, and actually help our patients really get well quickly. So I think those are all the aspects. There are some technology things. I haven't talked about a lot of tech stuff yet, but data integration is really key. Data cataloging, data management, data quality, all of these are really important. So you have to have a good platform to manage, secure, and share data. That's always really important. And modern capabilities in the cloud and such allow you to do these things really, really well. So take advantage of those and really bring partners in who can help you think about your use case, and help you elevate the technology in service of the patient.
Okay, I think I have all the ingredients here. So that was great. That was gold. So, first thing you said is healthcare is a team sport. Tell me if I got the quote right. We all work together. We all win together.
Yes.
Okay, so we got to create a strong team with that mantra. Number two, and this isn't in any order, folks. Using the One Sutter as the example, the North Star I wrote in my notes. The leaders across the organization, part of your team, have to have the one common purpose of serving the patient. I think you used the word serving our patients. So whether you're a health plan listening, health system listening, serving that consumer at the end of the day is the North Star. So now you have those two things, right? The mantra of team and the North Star, which is we're serving our patients.
Yes.
Then you had a couple of other things. I want to make sure I get this right for everyone listening. What's the most important thing we should be working on that AI can solve? Now, that's a hard question to answer when you have a lot of competing priorities, but that is something you have to move this culture forward. What's the most important thing we should be working on that AI can solve? And then you said you need to put together governance, which we talked about and unpacked in detail. So you have the blueprint for that if you're listening. The one new thing you said, which we're not going to go deep into because that's a whole show or two or three, is data quality and integration is paramount, and you must have a good platform in place. So if you just are trying to change the culture and you don't have that in place, you're going to have to start working and investing on that, or you're not going to be, a lot of the other things you're going to try to do are going to potentially fall short. Jump in if I'm getting this wrong.
Spot on, Eric.
And the final thing, the lesson in execution is don't get stuck in pilot land, go big, go deep.
Yes.
God, I love that. That is gold. All right. We still have a little bit of time left. I want to get into ROI in the future because I know you have a lot of really cool things to talk about. So We mentioned reframing ROI a little bit. We alluded to it when we talked about the non-financial stuff in AOI, especially with AI as context. Um, can you walk us through the framework of how you're applying ROI at Sutter that goes beyond what we talked about earlier, with knowing we're doing the right thing and performance, and maybe getting a little bit more into dollars and cents, especially if someone's listening and wants to build a business case tomorrow for their executive team and they need to kind of show that business case, and the dollar sign's going to have to show up eventually.
Yeah. Um, I would recommend using the framework that I talked about earlier, which is the input and output metrics. So the idea that, let's say quality, for example, how many quality incidents you had or you have is a input metric. It just tells you, here's the checkbox of how many actually happened. The output metric ultimately is, your, in the case of an acute scenario, is the patient discharged quickly, right? Is the length of stay or the utilization improving as a result of better quality? So if you put an AI model in place that predicts, the incidence of sepsis, for example, or some level of disease state, you can actually then impact, the overall level of quality that ultimately translates into, better patient experience, better care for the patient, and ultimately a better utilization for the hospital. So Sutter Navigator is a tool that we built that shows all of these metrics in great detail. And those metrics then ultimately have a financial implication to it. Now, if you reduce your length of stay, one of the things we did recently, we worked on a lot of operational improvements that allowed us to reduce the length of stay, which would have been the equivalent of building a 100-bed hospital, which if you sort of think about it, we were able to create capacity in the health system by being able to measure and improve the operational readiness of some of these processes. Some of it is better visibility, some of it is improved process, and some of it is application of AI as well. And so the idea there is these ROI metrics ultimately go back to some standard ways in which we can measure the patient experience. Make sure you have those, and then the ultimate thing is the patient satisfaction. So we measure that through patient satisfaction surveys. We get hospital health grades for our hospitals by reputed institutions, and we see our hospitals are rated really, really high for quality. And again, those are some intangible but very powerful ROI metrics that justify why you implement something.
Okay, so you've mentioned Sutter Navigator a couple of times now, and it seems to be the foundation to be able to really measure ROI in an appropriate manner that allows you to actually create cultural change. I mean, I guess this goes to the data platform that we talked about just earlier. Let's talk to someone who has sort of a moderately to well-funded health system, but doesn't have Sutter Navigator.
Mm-hmm.
But we need to start working on a really reframing ROI around innovation. And we'll talk about AI specifically, right? That's our topic. What would you recommend they do? Like, what are the key kind of things they need to be looking at? We don't have that full system view and everything that Navigator brings to your organization. How would you advise someone to go about doing what you do?
I would start with, what are some of the most common and reported metrics in the organization that people have aligned on. Now, if there's no alignment, I think we would start with alignment first, because if there are 5 ways to measure a metric, then that doesn't matter what system you build, you'll end up with 5 measurements and no alignment, right? I would start with a handful of metrics across the journey, the patient journey, maybe starting from access, understanding the patient experience around access. If in the case of acute, maybe how long does it take to get admitted into a hospital, the length of stay. I would look at some of those. I would look at industry benchmarks as well, and sort of compare and contrast and say, how does this health system rank against best in class? But having a mechanism first to know what are the key measures or metrics that matter is the starting point, right? Once you know that, the next step is to go find all of the data that helps you produce that information in a very, very sustained way. And this is where I think the challenge comes in, because information can be scattered across the board. So it's important to kind of bring it all together, or at least connect to it wherever it sits. In our case, we actually go to all the different sources of data, whether it's EHR, whether it's our time and material system, our supply chain system. We're able to go to those systems and interrogate those systems and get the data we need. In some cases, we bring it all together as well. So having a tech platform to support that is important. But you can start small. You don't have to have the whole, kit and caboodle. You can start to build some small capabilities with the tools you already have. Establish the cadence and the operating rhythm. And this is the most important thing, right? It's not enough to just have the tools and the aligned metrics. It's about what you do with them. So having good operational reviews, having very periodic check-ins with your teams on how these metrics are trending and the actions you're taking to improve them and make them better are all really important. And we did that really well because we set up a whole cadence of monthly operating reviews, weekly operating reviews, where we could quickly see where metrics were trended and who are the accountable owners that would go do something about them. And I think so setting up those processes is really important. And then the last part is make it easy, right? As easy as possible. If, one of the things I talked about is data democratization. So at a certain level in the organization and above, everybody gets the tool. Like, there's no access to get to the tool. There's no security to try to restrict. I mean, we want these most important Sutter metrics to be available to everyone. And we actually publish them in management meetings. Our CEO, Warner, talks about this all the time in his town halls. And so it's important to get people to understand the metrics we're aiming toward and working towards them, and what progress are we making. So making that transparent platform is also going to be very key. So those are some examples. So some things I would do just to get started and going.
Okay, so first of all, going backwards, the Sutter tools or the published data, I'll talk offline when we stop recording, but we'll get those links in the show notes if there's anything that's publicly available. Because you said there's some public.
These are publicly, these are available to Sutter, not external to Sutter. Sorry.
Sorry to tease everyone. Got it. Let me summarize then what I heard you just say, and I've got some thoughts. So, first of all, you need to understand the most common input or metrics in the organization where there is alignment. That's key. So quality, access, and time to get a bed or an appointment, LOS, all that. Then you said establish a cadence and an operating rhythm. I thought that was really important. And then make it as easy as possible to access the data so everyone could see it. And I would say you're just a quick there's two things that I don't know. Are you a Measure What Matters guy, the book Measure What Matters?
Yeah.
You know?
Yes. It's a great book.
Yeah, it's a great book. It's by John Doerr. It basically takes the concept that Andy Grove created and who's the CEO and founder, correct me if Intuit, right?
Yeah.
Yeah. And made famous with, and I think key objectives and results. I think that's a great book. Everyone should look at it if they haven't. Maybe a lot of people have already read it, but that's a great book. The other thing that struck me when you were talking, and I don't want to get everyone involved or think that we're going off topic here, but there's a system that I research a lot because I'm the CEO of a small business called the Entrepreneurial Operating System. It's called EOS. But if you Googled level 10 meeting at EOS, the concept of a cadence and operating rhythm and how you pick the key things to talk about, review, and almost create your pseudo poor man's Sutter Navigator, if you will, I think are covered a lot in the level 10 meeting. So if you Google that, and I'll put those links in the show notes so that people have it. It just struck me when I was listening to you that those are two resources that you're kind of alluding to that I think our listeners could dive into more if they want to execute on this. I want to close things out with looking at the future. So we've already, I think, covered that if we were just starting out at a health system, what to do. And those are all the things you talked about with team and, looking at the patients as the North Star. We covered all of that. But I want to balance now optimism and sort of what I'll call slowness or caution in the wind with AI in the future. And I want you to think about, for you, because I'm sure you're sitting up at a high view looking at the future, in 2 or 3 years, knowing that we're at organizations, as you very well pointed out, that have to be balanced between being slow and risk averse and fast and innovative. What are two things that excite you the most that you're looking at 2 or 3 years, and then maybe one or two things that are keeping you up at night? And maybe they're the same things because you're so excited, or maybe not.
They blend together actually in a way. um, I'm excited about how AI is actually helping us get better in healthcare. I mean, and it's a broad statement, but I'll qualify it and I'll tell you what I mean by that. Um, there are many disciplines within healthcare that historically we couldn't attack fast enough because we were constrained by either technology or just the sheer time to go do and evolve. um, Research, for example, uh, we can do so many things faster now. We can run so many different scenarios now, and all of that to really support the specificity of medicine to a human being, right? So previously, we may have zoomed out a little bit and tried to sort of solve um, a certain instance of illness based on knowledge of a certain group of population, right? But now we're getting so fine grained, and we actually can do very specific, um, nuanced care, precision medicine, for example, based on the data and AI, right? We have an amazing chief scientific officer. His name is Matt Solomon, and he and his team did some cutting edge work in really predicting the incidence of cardiovascular disease in certain underprivileged populations. And historically, we didn't have data about these populations, and so underrepresented, I should say, in the overall ecosystem. So when you do predictions about, is this person liable for stroke or potentially, for a heart attack, the data you were using was trained on maybe a certain population. But what Matt and his team did is really amazing, that we actually incorporated a lot of data using some of the largest data sets in the country to be able to then fine tune the type of access that we need, or the fine tune the type of care that we need to our patients. That's amazing. So that's an example of what I'm excited about, is just so much data out there that we can actually use to really improve the quality of care and target that to specific individuals. Now, what keeps me up at night, and what I'm very cautious about, is the fear of losing that trust. Right? Is the fear that we use AI at face value, right, and just start to implement it across the board, thinking that it's actually doing the right thing, while maybe it's not actually trained on the right place, or it's maybe hallucinating. So we have to be real about the risks of AI. AI is getting better every single day, thanks to a lot of contributions being made by many healthcare systems. So I'm forever thankful to all my colleagues in many healthcare systems, because you're actually helping make AI better. But at the same time, it's not going to be perfect anytime real soon, right? It still needs a physician to oversee and look over what it's saying and make sure that it's actually the right thing. And the danger I see is that we become complacent and we actually sort of trust it for face value right off the bat. I think we have to trust and verify. Trust but verify. So,
Sorry, trust. What was the middle one? Trust,
but verify.
but verify. Trust, but verify. Got it. Great. Another good soundbite. This was really great, Kiran.
Thank you.
Thanks so much for doing this. So I'm gonna, last question, didn't send this to you in advance or anything, so I'm gonna put you in the spot. What would be? It doesn't have to be AI specific, but for those listening, what's a book or a podcast that you listen to, whether it gives you inspiration, purview as an executive, purview as an innovator, or is it specific to healthcare and innovation? That's fine. But what would be like a book or a podcast you'd recommend to everyone that sort of has helped you, do your job better?
Gosh, I have to go and pick one. I listen to many, by the way. um, there is a podcast that I listen to on a pretty regular basis, and it's not necessarily AI, but it's about the mindset that goes into building great companies, and it can be an AI company, and it's called Grit. So Grit is it's a production by Kleiner Perkins, in the Silicon Valley. They've actually helped a lot of organizations. They've funded a lot of organizations to start up and be very successful, and funded them through the way. I listen to that because the conversations are really about leaders who took something from something very small to something amazing, and the trials and tribulations that go along the way. And I really love that listening to the journey, because technology and AI in healthcare is a representation of grit. You have to be persistent. You have to continue to have the mental sort of fortitude to continue on regardless of the challenges that come your way. And what I think this podcast does, is really encapsulate different points of view on how you can do that. So I thought that would be a great one to share with others.
And I'm a pretty avid listener as well of podcasts. I do not have that one on my radar. So you just gave me something. That's great. Great endorsement. Connor Perkins should be sending you some sort of
I just love it. So it's a good.
Oh, this was great. I want to thank you. Thank you for doing all this. For spending all the time. This was super interesting for me and helpful for me selfishly. So I appreciate it. I want to thank everyone for tuning in today. We at Bright Spots never take the time you spend listening, watching, whatever you're doing with us for granted. We know you're super busy. We hope that you're able to use some of the ideas, or are able to use some of the ideas, some of the bright spots that were shared with you today to inspire your thinking and enhance your organization's current approach to improving healthcare for all of us. We produce this show for all of you. This is your Bright Spots in Healthcare podcast. Until next time, take care, everyone.